Symmetrical muscles relaxation. Use special crystal touch face points. These are 2 points, as you can see on the picture. One is here between the eyebrows. Another one is here in the middle of your chin. Or you can place it a little bit higher or in the middle of your chin. How you work with that? First, you close your eyes. For some people, it's easier to work with open eyes, but we always suggest to close the eyes so you can concentrate on the sensation in that point. You close your eyes. You can do it even now as I talk. You close your eyes. You put your full attention to the point between your eyebrows. Try to feel it. You can touch it at first to get the indication what you have to sense. And then when you feel that point well, and you feel like it is there in your face or on your face, you imagine that from that point spreads slowly upward and outward the wave of relaxation. So you start to relaxing your muscle fibers. Facial muscles. Muscle fibers is too much. Facial muscles, one by one. Frontal muscles, procerus muscle, the one which makes us frown. These 2 muscles that put our eyebrows together. The upper part of the circular muscle of the eye, the frontal muscles, and you imagine that relaxation wave spreads from that point outward and upward and a little bit downward in the direction of your mouth up to the nose. That's the first part. When you get that, without losing that sensation, maintaining it in your mind, you touch your second crystal touch point in the middle of your chin and do exactly the same exercise, spreading the wave of relaxation from that point outward and upward. Here we have a lot of muscles, so you really have to pay attention to what each muscle is doing, and for that you will need what is called proprioception. We'll talk about it a little later, also in this presentation, but you need to concentrate on your feeling, on your sensation coming from your facial muscles, because it's very often, if not always, that the patient with complications and residuals of facial palsy has much lower level of perception of his affected side of the face than he or she has from the healthy side of the face. Sometimes the patient, even without realizing it, stops to use that part of the face during speech, during emotions, during eating, during whatever facial movements he or she may need to do. He neglects this part and start talking and eating only with one part of the face, and by that you make the situation even worse than it already is. So when you are working on these 2 points, you really have to learn slowly by slowly to listen to your face. And in that task, your hands will help you. We'll come to that in really a few moments. So these 2 relaxation points are very important, and whatever we start to do with our patients, we start with learning how to use those 2 in order to regain our ability to relax our facial muscles at will, which means to disengage that volitional center of the brain that constantly is trying to stick his amplifying nose into our facial expressions. We don't want that. We want to get rid of that intervention, and that's why we need to learn to relax our face at will. Internal mirror. I think that's a good illustration how you should do it. You imagine it, your face in your internal mirror, and in that mirror you can see your face fully symmetrical, in perfect harmony, smiling, laughing, doing whatever you want to do, and that will be your guiding star on your way to the recovery. You will use this internal mirror. There are also more sophisticated techniques which involve this internal mirror, but they are outside of the scope of this presentation. We learn them together with our patients during the working sessions. Your hands, as I said, your hands is your main working instrument, and it's meant to train your facial proprioception. Proprioception, proprio, self, septio, perceive. So how you perceive yourself. Here, the most sensitive part of our hands are, of course, the tips of our fingers. And you can see here on this face, we have a relaxation points, 2 of them, we're already familiar with them, with another one which is called crystal line. We'll not talk about this one. It's also one of the basic techniques, but it's again outside of the scope. Otherwise, this session will not end earlier than 3 or 4 hours later. But let's talk about the hands as main working instrument and at their main goal. What you need to do with your hands to train your facial proprioception, which means to be able to perceive or to realize, to know at any given moment what your face is reflecting, what your facial muscles are doing, not only on your healthy side of the face, but also on the affected side of the face. And as soon as you become fully aware of that, you can relax those muscles at will. You can control whether they are contracted, yes or no, and you can control whether they are involved in your synkinetic movements, yes or no. You will be able to control that involvement, but it's really, really, really very sophisticated technique which involves a lot of training, a lot of practicing, and a lot of guidance, of course. Let's talk about facial proprioception. Proprioception. I very often during our live seminars, I ask the attendees of the seminars, what do you need to teach the elephant to stand on the ball like it is standing here? There are many versions of answers. Some of them are persistence, absolutely. Dedication, couldn't agree more. Positive feedback, of course. You cannot push the animal to stand on the ball if you only kick him and hit him and shout at him. You have to give him positive feedback. Some petting on his task or the shoulder, or giving something nice, or just talking nicely to him, and then he will like you and like what you're asking him to do. That's exactly the case when we are working with our face. Coming back again, we don't have to hate our face. We gotta love it, because when we love it, our face receives positive feedback from ourselves, from the friend. Our face has no other friends besides ourselves. That's very important to realize and understand. What is proprioception? To give you an example, very simple. Let's make a small test. Close your eyes, and with your index finger, touch your nose without looking. I'm sure that most of you, if not all of you, have succeeded in this small exercise. That is called proprioception, which means that at any given moment, our body knows what it is doing. Even with our eyes closed, we know that, for example, I know that I'm sitting and my right arm is resting on the armrest, and now my palm is stretched and up, and now I'm touching my nose, my ear, my other ear, my chin, and so on. That is proprioception. There are certain sensors in our body, in our joints, in our muscles, that send that information to the brain. So the brain knows, okay, I'm sitting or I'm standing, or I'm on my one foot or on my four, or any other position my body has assumed. My brain knows about it without even looking. Exactly the same thing is with facial proprioception. Whatever our face is doing, smiling, frowning, squinting the eyes, or blowing the cheeks, our brain will know it even without looking in the mirror. That is proprioception. And it is extremely, extremely important for managing of your facial expressions. Because if your brain does not know what your face is doing, how on earth he can manage it? That's why, for example, if you want to make a small smile, just little smile, yeah, our mouth corners don't go wide up to our ears, because our brain knows, okay, I want to make a small smile, so I will make it until I receive proper feedback, proprioceptive feedback, that my mouth corners are a little bit stretched to outwards, and that's it. When we want to make a broad smile, Hollywood smile, then our brain sends different kind of signals to our mouth and also to our eyes, because in a genuine smile, eyes are also involved. So you can always distinguish the fake one from a genuine one by looking at the eyes. So when the brain receives proper signals, which are compared with ideal signals for that particular emotion or for that particular intention, he knows, okay, fine, I have achieved what I wanted to achieve. Let's stop on that. Don't pull it any further and don't let it relax, because this is the expression I want to make. But of course, the affected side of the face, especially when the recovery is incomplete, slowly by slowly has lost that ability, or at least reduced it very much, to perceive correctly what the various facial muscles are doing. And that is why, without realizing it, we may be pulling our mouth corner or contracting our musculus mentalis, the chin muscle, or the muscle pulls down our mouth corner. And then we're wondering why our face on the affected side is looking differently. It's because involuntarily we don't realize what our muscles are doing. And that is why we need to use our hands to enhance and to redevelop, to bring back our facial proprioception. Why? Because we need to restore the symmetric perception and sensation of our facial muscles. That's important. Otherwise, our brain cannot manage our facial expressions properly if he doesn't sense them normally. We should also learn to differentiate finely and accurately the work of our muscles. So we will need to, let's say, give a signal to our muscle, contract or relax, and being able to perceive, to receive the sensory feedback from that muscle. Okay, I'm contracted the way you asked me to, or I'm relaxed to the extent you wanted me to relax. And as a result, we can train ourselves to consciously manage our facial movements and expressions. And when we can have our facial expression in balance, vertical, horizontal, smile of Buddha, for example, on the other way of the highway, which goes back to the brain, our emotions will also regain their balance, because you cannot feel totally at peace with a face very angry. Sooner or later, your feeling of peace will be gone. And the other way around, your emotions that are pulled all over the place will be very much restored and rebalanced if you just make your face looking balanced and symmetrical again. And for that, you need proprioception. So I hope you agree with that proprioception is very, very much necessary for recovery of our facial expressions. Here are small illustrations just to show that people who are affected by a facial palsy, who have developed synkinesis, do not always realize that their facial muscles are contracting. To show you, you see here the gentleman is puckering his lips, and it's not on purpose, it's involuntary movement, which the person cannot control at will. The moment he puckers his lips, his eye closes. Same story when this gentleman wants to blow his cheeks. You see how distorted his facial expression is, and his muscles, especially on the affected side, are totally out of order, totally out of control, and totally out of balance. And when this lady is wanted to squint her eyes, her eyebrow, instead of going down, is pulled up. As you can see here, some fibers of her frontal muscle are contracted by pulling her eyebrow up. And of course, because of that, he cannot squint her eye to match the expression of her healthy eye. Together with that, you can see here some folds, and her platysma, surface muscle of the neck, is also tense, contracted. And it's also because from being used to engage muscles over intensively, we use also our sensation of what our muscles are doing separately from each other. We only have mass movements and mass sensations. It's contracted, but what is contracted, what is not, we don't know. And we have to work on that restlessly and without giving up our motivation. To check how the facial muscles are working and how far the facial expressions, connection between the facial muscles and facial nerve, or the other way around, between the facial nerve and facial muscles have been recovered, we are using what's called neurological tests. It's a number of certain facial expressions that are aimed at testing the ability of certain muscles or muscle groups to perform their tasks in a proper manner. As you can see, 9 expressions: neutral, eyes closed, eyes shut, squinted, surprise, kiss, balloon, blown cheeks, smile, a light smile, broad smile, and a grin. And here, just to remind you, here on the right side of the screen, you can see a reminder, the picture with facial muscles, because those muscles we need to produce facial expressions, and those muscles we want them to regain balance, to regain their ability on both sides of the face to reflect our emotions in a symmetrical manner. And as we discussed also earlier, the function of the coordination between the facial muscles can be measured. And what you can measure, you can manage. Here on the left side of the screen, you can see synkinesis. This is blinking tight, squinting your eye periodically. You can see the eye is blue, the mouth area is green. You can see that the effort applied to the eye area, the effort applied to the mouth area, involuntary contraction, is having higher intensity than the efforts applied to squint the eye. This is synkinetic correlation more than 1, which means that the muscle slave is exercising much higher contraction level than the muscle master. Here here below left, you can see the periodic smile, broad smile. Also, when the person is smiling, the eye involuntarily closes, and this is reflected here. And the excessive efforts while smiling, as I said in the beginning of this webinar, it can be also accredited to the involuntary involvement of a muscle depressor anguli oris, or the muscle that pulls down the mouth corner. Due to the development of abnormal mimetic pattern, together with engagement of zygomatic muscles for smile, the brain sends signal also to the muscle that depresses the mouth corner, and they both engage together. And because the brain wants to receive a proper signal from the zygomatic muscle that I have pulled my mouth corner to a proper distance as you ask me, he can do that because the other guy is standing in the way. So he just increases the level of contraction, which we can see here is very long and pretty intensive. On the other hand, on the normal circumstances, the involvement of other muscles is really minimal. As you can see, this is squinting the eye with force, and the mouth is really hardly involved, just a tiny engagement, which is very normal. Almost every person, when he exerts strong efforts on the face to squint eyes, or to pucker the lips with effort, or to make broad smile, as you can see here right below, this is the smile, the intensive Hollywood smile, so to say. And together with the smile, there is slight involvement of the eyes, which is fairly normal, especially when you have a broad smile. Then the eyes are always involved. As you can see here, I'm smiling, and my eyes are also become a little bit closed. That's how we measure our performance. Now let's take a little bit a look at a few results that our patients have achieved together with us, of course, or we together with our patients. You name it as you wish. It's these results. These patients, not all of them have had Bell's palsy in its classic representation, but they all have had some issues with the facial movements and functions of facial muscles. First, as you can see, here is a lady from Finland. She's 72 years old, and she never had Bell's palsy. She never had Ramsay heart. She never had trauma. She never had any surgical damage to her facial nerve. What she has is a genetic neuropathy. It's called amyloidosis Finnish type, because for some reason it mainly manifested in Finland, in southeastern part of Finland, if I'm not mistaken. And it's a disorder or disease, you can call it as you prefer, when after a certain age, most of the time it's about age of 45, it starts with the eye muscles. So the pathological proteins start to deposit in the nerve tissue of the facial nerve first, and then it goes down to the rest of the body. It takes many years, but as a result of this process, the facial muscles, actually facial nerves, slowly lose their ability to conduct the signals from the brain, and the face takes the expression, as you can see here, mask-like, expressionless, and with all what comes with it. You can even see those small golden weights in your eyelids, because due to that development of that disorder, she was not able to close her eyes properly or to blink them. That's necessary, of course, to preserve your cornea from drying out. And we worked with this lady in Finland. We worked with her quite long. It took more than a year. It took 7 working sessions. And of course, she was working at home. And as you can see from her picture on the right side of this slide, she has also not only regained her facial movements, she has also regained her emotional well-being. I wouldn't say that it's became 100% as if she were 45 years old or 20 years old, but as you can see from her facial expression, it's much more optimistic, it's much more positive, and she's even smiling with her, especially she's succeeding with your left mouth corner. It's right from, if you look from our side. And it's not here on this slide, but I can tell you that she even regained her ability to whistle like this, which of course, looking at her condition, what she was before, she would not be able to do. But she did, and we have it somewhere on the video that she is whistling to us and talking and speaking and reading poems. And so it's quite a remarkable result given the starting point of her rehabilitation program. So she did very well. She was very persistent, and she achieved good results, as you can see. And this is a young woman of 37 years old. She was born with facial palsy because it was a pretty complex delivery for her mother. She had shortage of oxygen during the process. And as they say, as a result of that, she was born with a facial palsy like this. She has come to us, and after 3 months, 4 treatments, we have achieved a result, as you can see on the right-hand side picture. I don't want to say that within 3 months she has recovered her facial nerve. No, of course not. The thing is that her facial nerve, as we can see from the picture, from the action actually, it has recovered during all those years of her life, slowly by slowly, slowly by slowly, slowly by slowly. But her brain has never developed a habit of using those muscles that have actually regained their connection with the brain and were perfectly able to do their job, as you can see from the picture on the right. So what we did, we sort of taught the brain, make the brain learn or to discover, oh, hello, I can do that. And that is the result of her rehabilitation program. After that, she took a few more sessions. She achieved certain level, and of course, because she was living the whole life with her, she never knew any other. So she, after achieving certain level of recovery, he said, "Thank you very much. I am satisfied. I carry on with my life." And that's basically what every patient that we work with is doing. After certain number of visits to the clinic or after some time, as soon as he or she has achieved what we call aesthetically acceptable results, the patient says, "Thank you very much. I am content. I'm not going to continue to come to the clinic any longer. I know what to do," because by that time the patient already has learned all the techniques, at least the basics and part of sophisticated or advanced techniques for rehabilitation. He or she knows what to do. If there is tension in the face, if there are some abnormalities, if there are pains, whatever, he or she knows what to do, which exercises to take and to do. And she says, "Thank you very much." And we are happy for her or for him. And we know that this person has regained facial movement, regained self-confidence, regained taste of life, because that's also what comes together with it. The taste of life, self-confidence, self-esteem goes up. The person is not ashamed anymore to go on pictures, on videos, on photos, make selfies, go out, make friends, go crazy on parties. That's also a big result that we are very happy to achieve together with our patients. These gentlemen have come to the clinic about 6 or 7 years after his facial palsy. As you can see, his smile have improved. It was also a big surprise both for him and for us, because after only 2 treatments, 2 months of rehabilitation program, he achieved these remarkable results. And I believe somewhere in our presentation earlier, or otherwise on our website and on some videos on the YouTube, you can see this same gentleman with some other facial expressions like pucker his lips or blow his cheeks before and after. He achieved remarkable results, and after just 2 months of working sessions, he said, "Thank you very much. I'm content. I'm not going to continue." Fine, his choice, his face, his life, and he's happy. We are happy, and we thanked each other and went each other's own way. A lady from Brazil, as you can see, also very good result, remarkable result after just 1 visit. And because she's coming from overseas, we have a lot of overseas patients who are coming. Later on, we will see the geography of our patients. We plan always 3 working sessions for overseas patients, because otherwise coming and going for 1 session, it's not to do. It's just too inconvenient, time and resources consuming. So she came to us, made one visit, 3 treatments, then went back home. And after 3 months or 2 months later, she came back, and we have seen this kind of result. This is also a gentleman from Brazil, from São Paulo, also a remarkable result after just 1 visit, 3 treatments. I have to say that this gentleman is very, very dedicated. I know that he's in our audience today. Wellington, you are a model patient to work on your rehabilitation techniques. You are a model in your persistence, in your optimism, and in your efforts that you exercise every day. And of course, the results are absolutely fantastic. My congratulations. Well, one of our youngest patients, a 3-year-old boy, as you can see, he didn't have a facial palsy in its classical representation. He had totally different disorder. As you can see, his left upper eyelid was having ptosis. Ptosis is hanging of the eyelid, so he couldn't open it fully because of that. And also the mouth corner on the left side was hanging, so it's also ptosis. And it's not related to facial palsy or to facial nerve in any way, because the lifting of the eyelid, upper eyelid, is assigned to a different nerve, oculomotor nerve, nervus oculomotoris, and also this one is well involved, the facial nerve. But in any case, after 4 months, because it was also our humanitarian project in Moscow, we are traveling to Moscow and working with patients over there, including a little one like this one. And you can see on the right hand side the picture of this young gentleman after about half a year or 8 months. We took the picture a little later than we finished those 4 months of treatment, but it's still the same. It didn't change. So you can see this beautiful boy is smiling full out. And the good part was that this eyelid correction operation that was already planned was cancelled as unnecessary, because, as you can see, the progress that this young boy have achieved. Actually, I have to say that it was a progress that his mother have achieved, because it's not him who was doing the homework during the time between our visits and our working sessions. It's his mother. So the credit goes to his mother, to her persistence, to her dedication, to her goodwill, and to her belief in herself and in her boy. And you can see how wonderful result they have achieved. So to summarize a little bit, we have done this work with our patient. We also have done our research, our thinking about why it is possible, how it is possible to make it better, and what foundation principles of functioning of our brain, of our emotions, of our facial muscles and facial nerve have made all those changes possible. And we have presented our conclusions and our scientific work on several congresses of neurorehabilitation. Now, to summarize our second part of this meeting, what effects do we achieve together with our patients after application of this method? We stimulate the regeneration of facial nerve. Just as the grass that you have just moved, the speed of regeneration of each fiber of facial nerve, each cell of facial nerve is different. Also, the grass blades, they grow at a different paces, and after some time, some grass blades have grown very high, some halfway, some have stayed where they were or almost where they were after being cut. Same with the facial nerve. After a certain time, the situation stabilizes, and the nucleus of the facial nerve finds its sort of a comfort. Our task is to shake that guy out of his sleep and push him to reinstate the regeneration process, so the nerve fibers that have stopped growing halfway would grow further on, and to reconnect more muscle fibers, so the mimetic movements can be more harmonious and the muscles gain more power. Again, we reverse as far as practically possible contractures and synkinesis. In theory, 100% recovery is possible, but it will take so inappropriately long time and require so much resources as on time and on the financial side, that together with our patients, we are aiming at what I already mentioned, aesthetically acceptable result. The result that is aesthetically acceptable for the patient, of course, not for us. Eliminate related headaches. Of course, we cannot eliminate classical migraines that were present even before the facial palsy. But I have to say that so far we have been very successful together with our patients to reduce or even eliminate headaches that are related to facial palsy, which are located mainly on the affected side of the face and the head, and also spreading sometimes to the healthy side, making the situation even worse and pain even more heavy. We restore facial symmetry together with the patients, not we. Again, it's not us who is doing the miracles, it's our coordinated and well cooperative work with our patients, because patients come to us only once in either 5-6 weeks if it's Dutch patients, or once in 8 to 10 weeks if it's overseas patients, and the rest of the work in between our working sessions is the job that patient has to do himself or herself. And that is what our patients, all of them, have to realize, that it's their work and their achievements. We show the way, but you will have to take that way and to go it up to the result that you want to achieve. Restores facial symmetry, as I said, again, in theory it is possible, but we have to keep in mind that not a single face in the world is 100% symmetrical. Every face, even if you think it is symmetrical, if you take a closer look, it is not. If you look at someone's face and look at his or her reflection in the mirror, we immediately see that his or her face is not symmetrical. Either the nose is a little bit curved, or there are some lines, as I have here a line just above my eyebrow, which I don't have on this side. Or my smile is, I'm smiling mostly with my right side and less with my left side. So what? Certain asymmetry in our face makes us unique. Otherwise, we may look, if we were all 100% symmetric, we may look as brothers and sisters of one parents, which is definitely not the idea. And the very important, and I think the most valuable result of our rehabilitation programs, of our joint efforts with the patients, is the increase of self-esteem and self-confidence, because this is our goal, to improve the quality of life, with or without symmetry, with or without synkinesis. If the patient is feeling happy, feeling satisfied, feeling vivid, feeling full of energy, and feeling very confident in himself or herself, we consider our job done and congratulate the patient, because it's all about having good life, having life with joy, having life where you can benefit from all sorts of activities, when you can enjoy your friends, when you can spend your time with your family, when you can go to concerts, go out, do crazy things and enjoy them without looking back, without being cautious. Oh, if I say that, or if I do that, maybe they will think that my face is no good. It is good anyway. And together we can help you. Together we can achieve improvements, and together we can bring back your smile.